Good afternoon, Team Wright-Patterson family. I'm Colonel Thomas Sherman, Commander of the 88th Air Base Wing and Installation Commander for Wright-Patterson Air Force Base. Thank you very much for joining us again in our weekly town hall. We so appreciate you taking the time out of your day to share a little bit of time with us and give us an opportunity to share some information with all of you. I think a lot of us have always been looking forward to these, and these have become very much a part of our routine as we go through our collective campaign against the COVID-19 virus. Along with that, what I wanted to do was really kind of hit a number of the issues that we were talking about last week, but most importantly, I wanted to make a confirmation with all of you. After a great deal of decision, our focus, working with our installation mission partners and so forth, we have determined that based on current conditions, the analysis of these data that we have in relationship to the virus, our local conditions, and how we see our ability here on Wright-Patterson Air Force Base, we have determined that Monday, the 18th of May, we will officially make our move into our Phase 1 of operations. So our Phase 1 on our return to full capacity covers a variety of different aspects, in which what I'd like to do is hit on some of the important highlights today with all of you. First and foremost, what the transition into Phase 1 is not. It is not opening the deluge to an immediate return to what we saw prior to COVID-19. What it really is an expanded footprint on our mission essential capability, and I really need to foot stomp that. We are still operating in a mission essential environment. However, based on our ability to look at our situation, realizing that we need and have the opportune time for us to open up our footprint here on Wright-Patterson to do some of that mission essential work here physically, we've determined that the steps taken to here are appropriate for what we're doing. So again, Monday, the 18th of May will be our transition to Phase 1. It is an expanded aspect of our mission essential posture that we're in. And in many ways, it's not going to look very different than what we've been experiencing here as we've been managing the phase of the crisis and our crisis management up to this point. What I wanted to do is kind of talk about what does this construct mean. What we've done by increasing the footprint is allowed our mission commanders the latitude and the authority to increase their physical footprint up to 20% of their employee population. And this 20% covers both active uniform military, it covers all of our reserve components, it covers our government civilians, and it covers our contract force that provides so much support in what we do. And so a 20% footprint as we look at our ability to manage that. Additionally, what it does is it allows latitude to the mission commanders. It doesn't require the mission commanders immediately jump to a 20% mark, but what it does is it gives them the latitude to determine their mission, make their own internal analysis, and then decide what is the level of footprint that they want to have physically working in their spaces. So I wanted to make sure that we highlighted that very important piece, that our goal as the 88th was to provide the greatest amount of flexibility and latitude in the most simple and intuitive environment for our mission commanders to be able to sustain their operations and start to gradually increase their footprint. What we may see across the installation is it may vary between our organizations. We have got 115 incredibly diverse and incredibly important mission partners here that makes Wright-Patterson so unique, and each one of them may do their analysis and look at it just a little bit different based on the needs of their mission and our ability to do that mission for the United States Air Force. So I wanted to make sure to highlight that point for all of you. In doing that, our responsibility to you as the 88th Air Base Wing is that we realize that we also need to dial up our service functions that we're providing to you as the employees. And this comes in a variety of forms. First and foremost, we need to provide you the latitude to be able to enter the base expeditiously and facilitate your ability to come into the work environment. So I wanted to hit our installation entry points real quick. On Area A, that will not change. We will continue to have 1A, which is our Fairborn Gate, which is near our commissary. We're going to have 12A, which is going to be our AFMC headquarters gate. That's going to remain its normal operating hours. And our gate 26A is going to remain focused on making sure that we're providing all of our commerce and large vehicle inspections going through. So that footprint will remain the same. However, on Area B, it's going to be just a little bit different. We're going to maintain 24-hour capability at Gate 19B, which is our national road gate, which has been open since the beginning. But what we're also going to do is for a time of 0600 hours in the morning till 1730 in the evening, we're going to be opening up Gate 22 Bravo, which that is our Interstate 675 gate. So in that time, what we're going to do is have that footprint so we will allow and facilitate our employees to be able to ingress and egress the installation and make sure that we're providing that capability to do that work. Along that, we've been working directly with our mission partners to look at some physical aspects that they do as far as how they bring their employees to work. We have been encouraging to all of our mission commanders that they work on a staggered process of bringing employees in, a staggered process in doing breaks and lunch, and a staggered process on allowing them to return home again. Why is this important? What we want to do is limit having, in essence, a rush hour at our doors to our facilities, our break rooms, our lunch times, and so that we're not in fact facilitating a conglomeration of people that are going to be together in one space at one common time. So by kind of giving the opportunity to stagger our arrivals, stagger our lunches, and stagger our departures, I think we're going to be able to facilitate some good physical balance between bringing people into the workplace and allowing them to take their appropriate breaks. Furthermore, what I also wanted to highlight, and some questions that came up last week, is what is going to be our policy on utilizing face coverings and masks? As you may be aware, our Logistics Readiness Squadron did a phenomenal job on issuing out a large number of masks to our population, and so each of our employees should have access to those to be able to come to work. So please work with your supervision, work with your respective organizations. If you have not received them yet, they will have them available to you, and we still have some that we can issue out if the need arises. Along with that, what we want to make sure that we're doing is following the Secretary of Defense's guidance. If you cannot appropriately maintain a comfortable 6 feet of distance between you and prospective coworkers, or if you happen to be in a break room or area, or you happen to be in a restroom facility or so forth, where those areas are a little bit cramped, that's when we want to follow that Secretary of Defense guidance and make sure that we're putting on a level of facial covering to provide that level of respect for ourselves and respect for the people that are around us in that areas. If we have that physical distance between us, then we have the ability to relax the facial coverings and be able to go ahead and conduct our work as we need to if we're in a particular workspace or not. So I want to make sure we hit on that as well. Furthermore, in talking with our mission partners, we've also encouraged them to use a concept called cohorting, which you've probably heard on a variety of different channels, agencies talking about this and about the importance of what cohorting does. In short, cohorting provides us the opportunity that we create teams. Teams of employees that will work together and be a part of a group that arrives, departs, and conducts their environment on the same schedule. In some ways, you've probably heard it at different locations called blue and silver teams or red, white, and blue teams, depending on how they break them up. What this allows us for is enough separation between mission teams that if we happen to find ourselves with an individual exposed, it allows our public health personnel to do the appropriate forensics and tracing so that we can find out who might potentially be impacted, but it gives us the level of separation to ensure that we're maintaining mission continuity, which is highly important to all of us. So this is a very important aspect of what we're doing, and our mission partners are looking at those things right now. Finally, an important point of this in our return to a phase 1 capacity is that ability for us to do sanitization of our workspaces. And again, our Logistics Readiness Squadron has done a phenomenal job. They have had the opportunity to procure sanitizing fluid and sanitization fluid. They have been producing it and allowing it to be put in bottles for distribution out to all of your work centers. This is going to be worked out through your facility managers and through your supervision, and it's going to give you the opportunity to follow the Center of Disease Control guidance and allow that opportunity to provide the appropriate sanitization of your workspace so that we are providing ourselves the maximum ability to ensure our own health and safety as we conduct physical work here on Wright-Patterson Air Force Base. Each of our mission partners has been tasked to provide themselves an internal cleaning plan, and so we're marrying those plans up with the supplies that we have, and we have got your back to make sure that you have what you need to come back to work comfortably, confidently, and safely. We have got some great information that we're going to share with you for the rest of this evening, and we have brought our subject matter experts with us again, and I don't want to take any more time away from them, so I'd like to take this opportunity to introduce Colonel Michael Fouch, our commander of our 88th Medical Group, who will give you our medical update this week.
Thank you, sir. Good afternoon, everyone. Thank you again for joining us. This afternoon, I'd like to follow up on our healthcare situation across the installation and the area by letting you know what's going on in the local situation as it continues to be unchanged from last week. With regard to positive COVID cases per day, hospitalizations per day, symptomatic patients, and our healthcare capacity in general, these numbers have either been steady or are trending down through the second half of April and the beginning of May. There have been occasional increases from day to day, but in general, the cases per day, the symptomatic patients per day have been on a plateau for some time. As we continue to assess the environment, we also pay close attention to how we are able to treat those with a positive case. To date, the inpatient and intensive care unit census within the Wright-Patt Medical Center and our surrounding medical community has remained low and afforded us the opportunity to treat patients outside of a crisis operation. As I have alluded to previously, it allows us to plan for surges, to build supply levels to accountable levels, and increase our knowledge of the virus, along with our testing and tracing capability. So let's talk about testing for a minute. The DoD and Air Force level testing strategy at the current time is as follows. We should be testing, and we are testing, all symptomatic personnel. Testing those who are exposed to close contact with confirmed COVID-19 personnel, and also testing DoD Tier 1 through 3 personnel after a 14-day ROM or quarantine. Those are personnel who are either nuclear mission essential personnel or deployed members returning from deployment, et cetera. Those are personnel we are testing. In addition, we are testing CDC recommended all inpatient healthcare workers with symptoms or in close contact with COVID positive patients and at-risk individuals, obviously with moderate to severe symptoms. Our currently available testing is diagnostic in nature. It's extremely useful in determining if COVID is the cause of the symptoms of a patient for ruling in a disease. It is of little value as a screening tool in asymptomatic patients or for ruling out the disease, because the results only matter at the time of testing. If we test asymptomatic patients and the test is negative, that does not mean that the person does not have the COVID virus. It only means COVID was not detectable at the time the test was performed. A negative test result today is of no assurance of a negative test result tomorrow. And therefore, this could actually be more dangerous to the spread of the virus. For these reasons, we do not intend to test everyone or asymptomatic personnel before returning to work. This strategy would lead us to quickly running out of our test capability and may give us a false sense of hope that the virus is not present. Once again, random testing is of little value at this time in decreasing the spread of the virus. There is a lot of discussion about testing for antibodies and why we aren't testing for antibodies at Wright-Patterson, and there are really two reasons for this. One, we simply don't have enough of an approved FDA-authorized antibody test to randomly test everyone. And second, the science behind antibody testing has not advanced to a stage where it would be useful in bringing personnel back to the installation. The primary issue with antibody testing at this point is really a question of accuracy. Because the virus is still so new, we do not know what levels of antibody equal immunity, and we don't know how long those antibodies may stay in your system. This is an area we are monitoring closely, though, but we simply don't have the science or the supply to begin widespread administration of this test quite yet. Again, I'd like to note that we're not moving into a phase 1 scenario because the virus is gone, or we have the ability to test everyone for it. We're preparing for phase 1, a small increase, as you've heard Colonel Sherman allude to, because we've built up our knowledge of the virus, our ability to try to keep personnel safe, and our capacity to handle the virus from a medical standpoint. What we need to continue to emphasize in phase 1 is teleworking, cohorting, staggering schedules, wearing cloth face coverings on the installation, keeping social distancing at work and in common areas, hygiene, hand washing, sanitization in our workspaces are very important. We're continuously monitoring the number of cases, hospitalizations, test and tracing capacity, and the capability of our medical community, federal, state, and DoD guidelines, all to continuously adjust our operations and our recommendations to our installation leadership. I promise you we have one goal, and that's to get everyone through this situation safely. Finally, I'd like to thank Team Wright-Patt today for answering the call to donate blood. After each of our town halls where I've mentioned our blood donation center, we've had 10 to 12 patients a day come in to donate. This is truly a life-saving opportunity, as our supply of blood is not only utilized at our hospital, but it's also packaged and shipped to our deployed service members in deployed service locations. Currently, our blood bank sits between yellow and green status, and I'd like to continue to encourage our team to donate if you can. If you're healthy, have access to the base, and can pass the COVID-19 screening questions, we're happy to take on all comers. Individuals can call our donor center with questions at 937-257-0580, or they can schedule a donation appointment online at militarydonor.com using the zip code 45433. Thanks again, Team Wright-Pat. I really appreciate your efforts to help us with this area, and I greatly appreciate your efforts to keep everyone safe. I'd like to turn it over to Colonel Paul Berger, our Mission Support Group Commander.
Good evening, ladies and gentlemen. Again, I'm Colonel Paul Berger, the commander of the 88th Mission Support Group here at Wright-Patterson. We've seen a ton of activity within the last just couple weeks within the Mission Support Group as they work hard to reopen many of the activities and functions, and in particular as we get ready to receive the additional workforce that begins returning to the installation next week. So I'll start with our Force Support Squadron, the members of which have been working diligently to reopen a lot of the recreational opportunities that you've come to know and love over the years, in doing so in a phased approach, starting with those activities that gave us the greatest margin of safety right out of the gate. Case in point was we reopened Twin Base Golf Course last Friday, followed by the Rod and Gun Club the next day, and both of those were doing really, really great business. To do this safely, we had to implement an appointment system as well as a number of other procedures to keep the patrons of those facilities as well as the staff members safe. The guidance for all of this is posted on the FSS webpage, and I believe Public Affairs is posting a link to that as well as I speak. As of last week, we were not able to open the restrooms on the golf course, but I'm happy to report that those restrooms have now been opened, so please feel free to partake in as many beverages as you wish while you're out there on the course. I'm also happy to report that as of 18 May, that's this coming Monday, the base's Prairie Trace Golf Course will be opening, following the same reservation and safety protocols that we've established with our Twin Base course. In addition to golf, Outdoor Rec is open for equipment rentals, Arts and Crafts is open for your framing and craft needs, and the Auto Hobby Shop is open to get your vehicle ready for summer. All of these activities are going to require you to make a reservation in advance and wear a face covering while you're in the facility. Now, I know a lot of you are very, very interested in getting our fitness centers open as soon as possible, and I can tell you the FSS is actively working that process right now. As you can imagine, there are some inherent challenges within fitness centers with regard to cleanliness and sanitization on a daily basis under normal circumstances. So given the COVID environment that we're in right now, the team is working very closely with public health and other experts to ensure that we open that safely and not prematurely. I think it's also worth noting that the state of Ohio has not yet opened fitness centers out in the general population, so we need to keep that in mind as well as we move forward. Keeping with FSS and some of the food operations, the club is going to be beginning to offer curbside pickup again of their new Wingman's menu. That starts on Monday as well. Simply call in advance, pay over the phone, and then they'll bring the food out to you when you arrive. So very, very simple there. Also on Monday the 18th, the FSS food truck is going to be at the base bowling center from 1100 to 1400 Monday through Friday. And what they're offering our customers there is kind of think of it as a drive-through option. You'll pull up to the truck, you'll make your order there, pull over and park, and then the team there will bring the food out to you in that parking spot. Finally, beginning this week, I'm happy to say that Wright-Patterson's Honor Guard resumed travel to perform military funeral honors. For now, the teams are going to be restricted to a 75-mile radius from the base, but they're gradually going to increase that radius as safety allows. It's unfortunate that we had to suspend those operations for a period of time, but it was necessary to ensure the safety of not only our team members, but the families in attendance at the funeral as well. The team's extremely eager to resume those ceremonies and to provide that dignified send-off for America's veterans. So most of you watching by now know that Governor DeWine authorized the opening of barbershops and hair salons beginning this Friday, 15th of May. The barbershop and the beauty shop on Wright-Pat are following suit and are also opening this Friday. A link is going to be provided by Public Affairs showing the hours of operation, as well as an outline of some of the new procedures that are going to be taking place that patrons will have to abide by when arriving for appointments. An important note is that the barbershops are going to be reserved for military only. This is from the 15th of May to the 25th of May, so for the first 10 days. You'll recall that since the early part of April, I think the 2nd of April, we've been operating under a waiver that allowed military members to have relaxed standards when it comes to hair length. You see mine is probably a little bit longer than you're used to seeing. Certainly it is for me. And what we'd like to do is give military members the opportunity to get their hair back into standards so that we can go ahead and rescind that dress and appearance waiver just as soon as possible. So allowing the military to go first does give us that opportunity to do that. Several times this evening I mentioned the requirement of face coverings when entering or frequenting many of the facilities on the installation. So I want to reiterate that this policy is also in effect for the commissary and the base exchange. That's both the main store and their express locations. And a face covering is essentially a condition of entry for these facilities and must be worn while you're inside. No one likes to wear masks. That's completely understandable, but that's kind of the reality of the world that we're living in right now. And it's not only for your personal safety, but for the safety of those around you. If a staff member or employee reminds you of this policy, they're doing so on behalf of Colonel Sherman, the installation commander, who signed the public health emergency declaration. So if complying with this policy is not something that you're willing or able to do, I would just ask that you simply refrain from entering those facilities. The staff is there to help keep you safe, as well as the other employees within that establishment and the other shoppers. So Colonel Sherman also, in his remarks, discussed the gate procedures. I just want to add on to that we're tracking, Security Forces is tracking on a daily basis the number of vehicles passing through those gates, as well as the times that they are transiting. So we're monitoring that very closely. In the event that we need to make some adjustments as to gate operating status or hours, we're going to have the data available to inform that decision. Keeping in the same vein of Security Forces, there was a change recently that removed the ability for individuals, guests, to enter the installation using just a driver's license. Essentially now they're going to need to get a pass. Doesn't mean by any stretch that those individuals are not able to come onto the installation. We understand that in some cases family members are accompanying an older parent or someone else to a pharmacy appointment perhaps, or to the commissary. Those individuals can still come onto the installation. It's just going to require them to stop at the Visitor Control Center to get that pass. So Public Affairs is going to put up a link to a process by which the sponsor, through a website, is able to do some of that paperwork in advance. So essentially they show up at the Visitor Control Center and the pass will be waiting for them after a quick check. So just keep in mind that there's no prohibition on visitors coming out of the installation right now. It does require them to obtain a pass before they do so. Colonel Sherman mentioned earlier some of the work that Logistics Readiness Squadron was doing to help keep the installation safe, and I have to give them a shout out as well. I was over there yesterday watching them fill, by today's count, we've got about 5,000 bottles of disinfectant solution, and that's for distribution across the installation. So if work centers were having challenges procuring some of that product on their own, just understand that the 88th and the LRS, we got your back on that. The distribution plan is going to be coming out very, very shortly to let building managers and others know how to come pick up that solution, but it is going to be there available for you very, very shortly. So in closing this evening, I just want to say thank you for your patience and understanding as the Mission Support Group adapted to operating in this COVID environment. We're excited about reopening many of the activities and programs you've come to enjoy, and just ask for your continued patience as we strive to do this in the safest way possible. Thank you and have a good evening.
Thank you very much, Colonel Fouch, Colonel Berger. Truly appreciate the updates that you gave our teams today, some phenomenal information. What I'd like to do now is ask Mr. Perdeman, do we have any questions right now that I can take this opportunity to answer?
Sir, we do have a couple questions.
You bet.
Sir, first one, shouldn't the base consider bringing people back until after they monitor what happens once stores and local restaurants start to open? General Bunch sent out an email saying that this would happen on 1 June, not in May. What happened to his direction?
So I think this is a really good question, and it covers a variety of different aspects. First off, installation commanders have been given the appropriate authorities to work on the levels and in their parameters given by both the Air Force, our MAJCOM commander, General Bunch, and has been promulgated through our variety of different partners. What this does is it allows us the opportunity to work in a specific amount of parameters to ensure that we are providing and making decisions that are in the best interest of safety and health for our employee population, safety and health for our families, and allows us the ability and flexibility to execute the Air Force's mission as we need to based on the current conditions. So I want to amplify that aspect. Our decisions that we took to get to the point that we are right now was done through a great deliberative effort. The collective knowledge and analysis of our teams allowed us the opportunity to fully assess both our immediate local situation and assess the federal situation in looking at how we can follow the President's guidelines as a move to Phase 1. As I mentioned before, Phase 1 is not so different than we're operating now, but it's a slight increase in what our physical footprint could be. General Bunch, as many of our other mission commanders across Wright-Patterson, are using their abilities to determine the best needs of their force and what actually we've been able to accomplish using a lot of our virtual platforms, our teleworking operations, which have proven to be incredibly successful. So along those lines, our aspect is to provide the pathway for our mission commanders to operate in a Phase 1 environment. Our mission commanders have the complete authority to be able to operate in those levels and make the best determination for the safety, health, and effectiveness of their organization. And if they are doing an amazing job right now on the platforms we have, then we are encouraging teleworking to the maximum extent possible. So thank you for the question, and I hope that cleared things up a little bit.
Sir, is the CDC guidance being used for reopening procedures? What data is being relied on to determine how each phase will progress into the next?
So this is very much a multi-phase and multi-platform approach. Yes, the Center for Disease Control information is very important to what our Incident Command Center, our Public Health Team, our Medical Operations Center, and how they're working the analyses of all of these informations. Furthermore, as a federal installation, we are also looking at the information that is being shared to us through the Department of Defense and the Defense Health Agency. And we also have a phenomenal partnership with the state of Ohio. So that partnership in the state of Ohio really gives us the local flavor from the state, also with the Greater Dayton Area Hospital Association. So when we look at a variety of different information points, study the analysis across the board, each of those provides a very important input point from trends, treatment, capacity, supply, logistics, all of those things that go into making our determination on how we move through the various phases. To kind of go back to the first question I asked, as we studied all of these data across the board, we made the determination that both from a medical and health standpoint to a logistical and support standpoint that we were ready to make this transition, and that same amount of rigor and those platforms will be used as we start looking at what Phase 2 looks like and the timing for that. So thank you.
Sir, as people come back to work, who makes the decision about who that 20% will be?
It is up to the mission commander. So thank you. And we really want to amplify, why is it important that we're talking about the mission commander? As I kind of started in the address, we have got 115 very diverse and very important mission partners here on the installation. Each of them have a very important function that they provide, whether it's for the Air Force, whether it's for the Navy, the Marines, the Army, or one of our many other whole of government partners that utilize Wright-Patterson Air Force Base as their staging point. Along those lines, as they make the determination on what their mission needs are, that's where that 20% comes in. And so what they want to use is that is the guideline, but they're not required to utilize all of 20%. If they feel that based on the platforms they have, the mission that's needed and their ability to accomplishment, they may stay simply between 10 and 15%. But with that, it is truly that authority of that commander to make the determination on how the mission works. And so our responsibility is to give them that bandwidth and allow them to operate within it.
Sir, a question about contractors.
Yeah.
How are they affected by this?
So contractors fit in the rubric that we've been going through on the analysis piece. So as I mentioned, it's really all about our uniformed, our civilian, our total force, and our contracting element. How this particularly pertains to our contractors, it is very much the relationship with the mission commander, our contracting representatives, our contracting office, and the individual company. Each of these specific companies and the contracts that are written are very unique in their own right. So what we really need to do is that on this level, from an installation, we simply give what the parameters are. But as each of those contracting representatives and mission commanders work with their particular companies on a mission essential platform, they're going to make the determination on how the relationship works from a physical presence to a virtual presence, and how those amazing partners that we have the ability to support our mission across the board. So it very much is, in essence, that tactical aspect on the specific relationships and specific parameters of your contract as it pertains to the service that you're providing the organization you work for.
Sir, we have one final question.
Okay.
As the base slowly opens up and in phases, will the people in high-risk categories or people with underlying medical conditions be included in phase 1, or will they be included in phase 2 or 3?
Thank you very much for asking that question. So I'd actually forgot to hit it as I was doing my intro, so it's perfect you asked it so I could circle back around. Yes, we are still ensuring that we are acknowledging and making sure to pay attention to our vulnerable populations. And as we've gone through, we have a variety of different aspects that provide to what are the parameters that creates a vulnerable population, and what does that category look like. So how it works with this is that obviously we are continuing to encourage, just with the guidance that we've been put out, is that our vulnerable populations, to the greatest extent possible, remain at home and utilize telework functions. However, the reality is that some of the mission essential functions that we provide require a physical presence. They simply do. And that some of those individuals that are in vulnerable populations provide an amazing service for the Air Force and need to have some level of physical presence on that. What our guidance is that that individual works with their physician and works with their supervisor to come up with the best mix and best ability for them to be able to support the mission in the full capacity possible while protecting their health and their situation to the greatest extent available. And so that's really a discussion that needs to take place along those lines. In many ways like this, because of the work that we do for the country, there are some areas that we have to enter into a discussion to come up with the right solution. But just know that risk analysis is constantly in our rubric on this, on how we look at risk from a safety standpoint and to a health standpoint. So I hope that that gave you the parameters. As we kind of conclude, we're going to be providing some further information as I give you my weekly end-of-week email that gets sent out. What we want to also do is provide a variety of different attachments to that, and I imagine that our amazing public affairs folks will be putting some of those things on our webpage right now as we look at this, but I will then push it out again on Friday. These are going to be areas as far as guidance from the Center for Disease Control on how we do sanitization of our workplace, how we continue to do self-monitoring, how we monitor our own health. And so all of those products will be provided to you as a reminder on how we can best take care of ourselves and best take care of those around us. As we've said, the fight is still on. The work that we are doing right now is truly making progress. And the reason why we're actually in a position where we can talk about the ability to go through change into a phase 1 is because of the investment and the tenacity and the strength that we all collectively displayed as we were going through this period of crisis. So obviously with change comes a variety of different things that we need to look at along those lines. And it looks at how this portion of our workspace operates, how we utilize the tools we have, and how we can continue to work in an environment, in essence, this new normal that we're in. And so really, as I kind of conclude, really the word that I wanted to kind of share with you that I think really fits to the situation we're in right now is respect. Respect is a foundation for all of us. It is the baseline of us as a military family. It is the baseline of us as a Team Wright-Patterson family. It is the baseline of us as an Air Force family. And that baseline means that everyone that we come in contact with is entitled to basic human dignity and respect. And that respect is a lot of different forms. Because what respect truly is, it's a force enhancer. That respect means that not only do I have the respect for myself and what I do to take care of myself, but likewise I have got enough respect for you as a member of our family here that I'm going to do everything I can to make sure that not only am I protecting myself, but I'm protecting you. That respect trends into how we treat each other. A smile as we come through the entry control point that actually shares some of that joy that we have in a nice day, or is able to boost somebody else's spirit when they may be going through a rough time. That respect that we have with each other that allows us to enhance our work opportunity. That respect that we have for each other means that we're wearing our facial coverings and our masks as we go about our business in the commissary or one of our AFES areas. Because that respect for us as a family like this really equates to trust. We can go anywhere in the world and come across somebody who is a part of this amazing military force we have. And because of that mutual respect that we have for each other, means that anywhere in the world, we can trust that member of our family member to take care of us if we find ourselves in need, but likewise, they can trust us to take care of them in their time of need. That trust that we've exhibited previously is going to be that very trust that takes us through transition, allows us to operate to our maximum ability in phase one, and will allow us to do it in such a way that we are truly stronger on the end of this. As my track coach when I was in high school used to say, is every day it gets a little bit better, and we get a little bit better every day. That is what we are seeing right now because of the respect and trust that we have in each other. I truly thank you for getting an opportunity to share another wonderful town hall with us today. I wanted to pay particular attention to the fact that we have entered Police Week. And if you have the opportunity to wish well one of our defenders at one of our entry points, or as you see some of our amazing patrols providing a great amount of safety throughout this wonderful installation, please take your opportunity to give them a bit of gratitude along those lines. And as we finished out last week, we were giving National Military Spouses Appreciation Day. Our spouses, whether they're uniformed military, whether our amazing civilian force or total force, our spouses are the very lifeblood that give us strength and allow us to truly do the great work that we do. And it really enhances the sense of family that we have. So I really wanted to acknowledge both of those days. I wish you the best as we go through this next week and as we finish up. I want to thank our amazing PA team for the great work that every time we do one of these, there is something unique and better each time we go along. And because we're doing it picture-in-picture now, I'm going to look up and say, Jay, thank you so much for doing an amazing job for us as always, and you truly lighten the room, and you truly provide us a great amount of support and make this a wonderful event that we enjoy coming to. Have a healthy, happy, and incredibly safe weekend, and we will look forward to seeing you at our next town hall. Take care, everyone, until we see you again.